the ilio-hypogastric and ilio-inguinal. These two nerves originate sometimes together, like this, and separately only here. Is visible like the separate here. Only the fascia, you see, covered. So here you have the two completely different components. You see here. And this nerve's ilio-hypogastric, so when I mark like this, here the superior component of this nerve is the ilio-hypogastric, the inferior component is the ilio-inguinal, exactly. And these two nerves goes between which muscle? Between the transversalis and two obliques muscle. Here you see the fibers of the nerves. So the nerve innervate which muscle? Anterior muscle of the abdominal wall. Yes? So this is the ilio-hypogastric, ilio-inguinal nerve. Ilio-inguinal nerve is continued by a crest, iliac crest here, and is open, is pierced. This nerve pierced which structure? What do you think? The here inguinal canal. Yes, we have the inguinal canal, two rings of the inguinal rings, the deep and the superficial, and exactly the ilio-inguinal nerves. This one pierced the lateral wall of the inguinal canal like this, and is continued and goes from a pudendus or the scrotum and innervate the skin. Yes, so this is this nerves, and here you see which nerve is visible now. This is it. From which muscle goes? From a to psoas muscle. So which nerve? The genitofemoral nerves. This is the genitofemoral nerve, and sometimes it's visible the nerves here is and here, but now from this specimen, sorry, you do not see the lateral, maybe here. Yes, I show you here. Look, so this is the same from this specimen. Maybe we use this during the practical test. Okay, thank you. Now you see here. Oh yeah, it's visible. This one. This is like the duplicate, you see? So this is the subcostal nerve. This is the ilio-hypogastric, ilio-inguinal goes together here, you see? Here and joined. Now it's visible, like separate. So always the superior one, ilio-hypogastric, ilio-inguinal. And exactly here you see which nerve goes from a superior anterior iliac spine. No, the lateral cutaneous of thigh nerve, exactly. Perform here the fascia like this and innervate the part of the skin. Yes, lateral part. So this is the lateral cutaneous of thigh, and the genitofemoral is visible here. Yes, subcostal, ilio-hypogastric, ilio-inguinal, lateral cutaneous of thigh, and here genitofemoral. And the two nerves extra here you see and find which nerve? No, femoral nerve. Yes. So look, what is a question from a written test? Which nerve originate from a lateral wall or lateral aspect of psoas major muscle? You see, it's a question. The first one is subcostal, all the ilio-hypogastric and ilio-inguinal, lateral cutaneous, and femoral nerve. The genitofemoral originate from the anterior aspect of psoas major. Yes. And which nerve originate from a medial wall of psoas major muscle? Here is obturator nerve. Yes, so the obturator is visible here. You see? Now it's visible. This one is an obturator nerve. So I think I write the question. Yes, refer to the position of this nerve and refer to the muscle. It's very important through a surgery of the abdomen. Which nerve originate from which aspect of the psoas major muscle? Which nerve from the lateral, medial, and which nerve goes from anterior structures of the psoas major? Yes? So here you have all the nerves. What do you have from a list? Exactly. Yes? Okay. So I look. Where's the femoral? This one, the big one, the biggest one. Yes, of the lumbar plexus. Anterior genitofemoral. This one, yes, genitofemoral, and has a duplicate the nerves. So you know the name show you which innervate genital. So the genital branch is a sensory branch, only the female, and the motor and sensory fibers of the men, yes, and the femoral. So this means innervate the anterior femoral aspect of the thighs, so the skin one, yes, here. And the rest goes from a canal. Which canal? Here we have inguinal canal, of course. So from an inguinal canal you find two nerves originate from a which plexus? Tak? Tak, ale przyjedziesz z tym moim ciałem. No. No ale Marcin przyjechał, wiesz. So all these nerves originate, these two nerves originate from which plexus? Lumbar plexus, yes? And the nerves of the inguinal canal we find apart from the lumbar branch, which nerves? The sympathetic. Yes, we have the sympathetic fibers, sympathetic plexus, innervate the testes, yes, from a man. So, which nerve we find? The cremasters, but the cremasters is like the muscle, yes, but the testicular plexus originate from a lumbar plexus, and here the part of the celiac plexus. Why the celiac? Because the innervate the artery originate from a aorta, and the artery, testicular artery, is a branch of the abdominal aorta and follow the course of the testis. So here from a man you find the four nerves. Two originate from a lumbar plexus and two like the sympathetic plexus, okay? But we discuss more about the plexus and the inguinal canal during the lower limb and during a pelvis tutorial, okay? So here is more visible. No. So this is a two psoas muscle. Okay, so maybe time is look what we have here. I don't know, it's a big surprise with this here. This is yes, so here you have the abdominal aorta, yes? And through this abdominal aorta, oh wow, it's good specimen. You see which artery, the first one, which artery is visible now? Celiac trunk, yes, this one is a celiac trunk. And the celiac trunk, the first one branch, no, this is a big one. So the biggest is a splenic artery. It's specifically circulate, yes, it's spiral course. So this must be the splenic artery. This is the left gastric artery and common hepatic artery. These three you have from your list, and it's possible marks from this specimen, okay? So I put always from an anatomical position like this, okay? And you know, when I mark, sorry, like this is celiac trunk. Here, splenic artery, left gastric artery, and common hepatic artery. The next one, here, what do you see here? This one, you know, what is this? This is a cross of diaphragm. Yes, this is a cross of diaphragm. Because the celiac trunk is a position of the which level of vertebral column? T12. Yes, yes. So this is exactly the place where we have the aortic hiatus of the diaphragm. T12. L1 is a position of which structure of the superior mesenteric artery. So here is superior mesenteric artery. You see, when I mark like this, superior mesenteric artery. Okay, and the superior mesenteric artery for you, I show you, is not for your list, but I show you what's happening here. What is this? Nerves, of course. All the artery is a surrounding by a plexus. Yes, so here you see this is a celiac, and here intermesenteric plexus is innervate in the small intestine. And here you see the small intestine. Look what is visible. Perfect. Now, what is visible here? Superior mesenteric artery. And here, you see this one? Here, this first branches, 1, 2, 3, 4 branches, sometimes the 5 branches, supply which part of the small intestine? Jejunal, yes? So this is which artery? Jejunal arteries, you see? This is the jejunal arteries. And here is which artery? Iliac artery, yes. Iliac artery, yes. So this is the jejunal iliac arteries. And here is one long artery, you see? Is completely separate, yes, artery. Is which artery? What do you think? Ileocolic. Ileocolic artery, exactly. So this is the ileocolic artery. Yes, this one. And the ileocolic artery here is visible, gives off the right one, but it's not exist now from this specimen, so I do not mark like this. Yes, here, and you must imagine this artery. No, sorry, but when it's completely, I mark you this artery. Now you see only the ileocolic artery, and this small arteries here is an appendicular artery. Vernifox appendix is supplied via 2 arteries, anterior and the inferior one is like the surrounding the appendix, yes. And here you see the following veins in the course of the artery. So this must be the which vein? Jejunal vein. Here is the ileal veins. Here is visible, and of course the nerves. And the nerve, the vein here, all the veins forms which vein, but is not visible completely. This one is visible here and here. Which vein? This is superior mesenteric vein. Yes, here's this part. So I think this specimen we use, and I put you like this, okay? The normal position, anatomical positions. So you see, but this is the anterior wall, like this one is normal. Now, yes, you see this is the border between the jejunal and the iliac. This is visible, the borders. This arteries is a biggest artery. Why? You know, because it's a part of the small intestine. We have the fifth part, yes? And 2 and 5th forms jejunum, 3 and 5th forms iliac, yes? So this means, but the rule is the same exactly. So the same number of the juice of the structures must be the distributes of the small intestine. So the must be the beta supplying system referred to the small intestine, the jejunum. So I put like this. It's for you, and of course here we must find which artery, but it's not exactly visible here. No, it's cutting here. The inferior mesenteric is not visible here. This one is which artery here? These 2, renal artery. And from a posterior wall, you see which arteries is visible. This is a lumbar. Yes, this is a lumbar artery, and this one unpaired from a posterior. This is like the very last branch. Dzień dobry. To podejdę na górę. Tak. Okej. To podejdę. So you try call me this artery, okay? And I'll back you from 3 minutes, okay? You try naming this artery. If it's correct, I give you the extra. Okay?